Hi, this is my final video reflection for my second rotation. It was at the VA Medical Center outpatient clinic, and it was a great rotation. It was awesome. I really liked it there. Could definitely see myself working there. The whole team was very great to work with, super fun, supportive, encouraging. Yeah, I have really nothing but good things to say. I feel like that clinic is ran really well. They have a lot of equipment. It's super cool just because it's federal, and just the way that it is for the veterans. They have a lot of things to offer, like TENS units, lumbar rolls, Theracanes, um, braces. The list goes on. Veterans can just come there and get assisted devices as needed, without making an appointment. They can just walk in and, ask for a cane or a walker. Certain ones might be specialty and they do run out sometimes. So then they have to put in orders for stuff. But yeah, it's super cool. The OT also, they have like a ton of stuff to offer as well. But yeah, super great clinic. I loved, my instructor was great. Love the population, a lot of chronic stuff, knees, back, um, just lots of different diagnoses. But I would say for the most part, it was chronic. Um, chronic pain, limited range of motion, limited strength, stuff like that. Some balance, gait stuff. But yeah, super, super great place to do a rotation at. It just ended a couple days ago, and I'm, actually pretty sad about it, just because I did really enjoy my time there. So, yeah, let's see. So as far as preparation goes, I kind of hate to admit it, but there is a portfolio that we have to put together for TheraX and for ortho, and some of the matrices and the different just pages we have to put together for that portfolio weren't always the most fun to put together. But really, I ended up doing a hard copy one of it. And prior to this rotation, because I was in inpatient before, but prior to this rotation, just to be able to have like one place to be able to go over all the different things like joint mobs, STM, just range of motion muscle testing, which we obviously do a lot of in the program, but kind of just to review before going to that setting was really helpful. So yeah, I did, like I said, hate to admit it, but I did end up using my portfolio a little bit. I even brought it to clinic with me sometimes, and it was just helpful to have if I, first of all, if there was a diagnosis, the diagnosis matrices that we had to put together did become useful for that, just as far as the different phases of healing and what you can and cannot do, or what you kind of should be focused on during those phases. Yeah, I did find that helpful. And sometimes too, just to like for active assisted range of motion exercises, or strengthening exercises, stretches, just to be able to kind of go to that motion that you're focused on and just be able to kind of see a list of things pretty quickly. Obviously, HEP to go is available to you. The internet was available, so you could look things up. But I did, just because with the portfolio, you do spend the time to kind of narrow down the ones that you would pick, or maybe ones that you particularly like. I just found that helpful. As far as my recommendation for the VA outpatient, I would just, watch the way your instructor does things, learn from them. You might, obviously, we learn things a certain way in class, but it's really cool to be able to see somebody who's had the experience and kind of honed in on their skills a little bit. So to be able to take that in and learn from that and utilize it, I think it's great to kind of know different ways for all different things. So whether you use it or, at least try it there, see how it works for you if you like it, and or just keep doing it the way that, you feel comfortable doing. But I thought, yeah, I don't know. I liked learning about the ways that he did things, and yeah, I asked a lot of questions. So, I feel like that was kind of important. Just, I didn't really hold back a lot. I really just asked whatever I want, whether I felt like it was kind of a stupid question or a great question or whatever. I asked a lot of questions. I would also say to be adaptable. Things happen. In my first couple weeks of being there, my CI ended up being sick, and the team was super, super wonderful as far as supporting me being there on my own without my instructor, especially so early on. So I really had the option to allow, or I had the option to like chart review, and they had told me that if they needed to call patients to have them reschedule, not come in that day, that was totally fine. They really left it up to me. And then, for PTs or PTAs who had available slots throughout the day, they just said, I could be paired with certain people, to assist me if needed. But you know what? I mean, I did my chart review. A lot of them I think I had already seen before, and other ones were pretty straightforward cases, it seemed like. So I ended up being able to handle the whole day on my own. And that was actually uh, it really helped to just kind of throw me in and just make me do, I took care of 100% of the caseload that day. They did cancel 2 people like off the bat in the morning, just to give me time to review prior to even telling me that they were doing that. So they did that. I did have 1 cancellation in the afternoon. So that was helpful. So I could kind of catch up on my documentation. But aside from that, it really did help me just to kind of be forced to have, so much of the caseload, and to just, not really have my instructor there to ask a ton of questions. I kind of just had to figure things out. So that was really great. Um, Challenges and strategies that I used. In the beginning, I think, especially in ortho setting, you have a lot available to do. So you can do you could do manual, you could do exercises, you could do modalities. So you kind of have, and there's obviously various different ways to do manual stuff. You have MOBs, STM, pin and stretch, just all these different things, active release. And then modalities, you have heat, you have traction units, you have, e-stim and ultrasound, all this stuff. And then obviously all the exercises. So I think in the beginning, it was really hard for me to, kind of know which route to go. Do I want to continue doing manual stuff with them, or is it now time to go to exercise? Or do I, try to fit in both in this session? At the VA, it was really great. We had 30-minute sessions with patients. So you really could do, 10 to 15 minutes of exercise and then end with STM or vice versa. So that was great. It just gets better over time. You kind of see how your instructor does things. You might even like watch other PTs and PTAs, how they do stuff. And you kind of just find out what works best for you and what you like. And I think it also helped to look at the patient's charts, kind of what, just aside from even what the last appointment was all about. Sometimes if I had time, I would go back to, previous sessions and just be like, okay, well, has it all been exercise related, or did they throw manual in here and there? Okay, well, so maybe we can, do a little bit of both. Yeah. So, and then regressions, progressions, you kind of just get better with that over time. Yeah, don't stress about that too much in the beginning. I mean, obviously you just want to do what's safe. So if you feel like you're not really sure, I would definitely go, less load, more easy things first. And you'll really quickly see, like, is the patient tolerating this? Is this too easy? Okay, now I obviously need to go up. Or the other way around, you try to do something and they're like, oh yeah, nope, this doesn't work for me. Patients will generally tell you kind of how things go, and or make a face or something, or you can just keep asking questions on how they're doing. The facility was amazing. Like I said, they had the 30-minute sessions. Documentation gets easier over time. Patient safety is critical. If you've done inpatient before, you probably already kind of have that experience and knowledge to really have that be like your prime uh, focus for every patient. But yeah, you kind of just, you see somebody walk in with a walker or a cane and you want to do an exercise with them. You just want to, make sure there's a chair nearby, make sure they're next to the parallel bars or, a plinth or something like that, just to make sure they're safe. You're obviously there to, guard them if needed, but just to make sure the space is set up safely for them. And yeah. And then really cool at this facility, we do actually, as PTAs, get to discharge patients just because we are the ones that are seeing them. They come in for the eval and then we're the ones who are working with them, multiple sessions. So we really at some point don't need to send them back to the PTs. And yeah, so we are able to choose when they get discharged. And a lot of times that's been something I just have that conversation with the patient and just ask them if that's what they want. And are we ready for that? They've met the PT goals, they've met their personal goals. So yeah, definitely loved it there. Could totally see myself there, working there. I really have nothing but good things to say. Super excited for my classmates who get to go there for their next rotation. So yeah, if that's where you're going to end up for your rotation, be excited. Every rotation has a little bit of nerves involved with it, but I really wouldn't be too nervous. It's a great place to learn, hone in on your skills, and just advance as a student PTA. All right. I hope this was helpful. Thank you.